Hello. Welcome to this episode of the Oh Baby podcast. I'm your host, Stephanie Poole. I am a certified lactation consultant, doula, and today we're going to be talking about how to decode the differences between a midwife or an OBGYN. If you are listening to this, you are likely pregnant or looking to become pregnant soon. And you may be wondering, what is the difference? And so we are going to get into the meat of that. So definitely stay tuned because by the end of this episode, you will know the difference. And hopefully, if this is a decision that you will need to make in the upcoming weeks or months, that you will feel informed enough to make a power-driven decision. And so definitely stay tuned. I'm really excited about this episode. If you are new here, we always start off the episode with a segment called What Up, Doe? And I decided to just use this opportunity to really allow, hopefully, you to have a bird's eye view of what's going on with me. What are some recent or current things that I'm liking, that I've read, that I've watched. And then in return, I always look forward to hearing from you. With that being said, I was trying to think, what am I going to get into in today's segment? And really, to be honest, I have just been getting back into the school group. So I have two kids. I have a 4th grader and an 11th grader. They are 6 years apart and they go to 2 separate schools, 2 totally separate schedules, of course. My youngest is a girl. My oldest is a boy. So their interests are totally different. And so school is back in session. The ball has started to roll in terms of after school extracurricular activities as well. So I've been really busy with that. I'm trying to find a workflow. So there's like this summer workflow and then it's like a fall winter workflow. I'm not quite settled into the fall workflow yet, but I'm trying to find it. I'm trying to find that balance of like, how many hours do I need to work and how am I scheduling that around drop off and pick up? And then also, like, I've tried to hop back into shows. And what I mean by that is, like, we've had a few that we follow over the years, and there's not been a whole lot of shows lately that I've really been into. And I'm hoping maybe this is something you can help me with. So if you know of a good show that you're really interested in, it keeps you holding on from episode to episode, definitely, please, if you don't do anything else, please DM me the show over on Instagram so I can take a look and hopefully start to watch it as well, because I really missed that. Other than that, I have been doing well. My family has been doing well. Oh, and okay, so here's another nugget. I recently celebrated another birthday. My birthday is in early September, and I thoroughly enjoyed myself by just relaxing. We just came back from a very extensive stay in Hawaii. And for my birthday, being literally like days after we got back was my birthday, I just wanted to relax and unwind. We had been on vacation. We had saw a lot of things, did a lot of things while we were there. And so when I got home, y'all, I was good. I just pampered myself and relaxed. So yeah, I've just kind of been in chill mode. But definitely hit me up on Instagram to let me know, 1, what you have been into as we transition into fall. And then number 2, to let me know of any good shows or movies that are worth watching. I am so interested, y'all. I cannot wait to see some of the recommendations that I'm going to get. All right. With that being said, let's go ahead and hop into this show, into this episode. It's a real exciting one on deck. So yeah, let's go ahead and let's get started.
Hey there! Before we start today's episode, I want to let you know about my free guide, Skyrocket Your Milk Supply, From Birth and Beyond. Now this is perfect for you if you want to get a jump start when it comes to starting and sustaining a successful breastfeeding journey. If you plan to breastfeed and you want to be successful right from birth, grab my free guide, Skyrocket Your Milk Supply, From Birth and Beyond. Just go to birthprepacademy.com/milk supply. Again, birthprepacademy.com/milk supply. Okay, Let's get started in this episode.
Okay, welcome back to this episode of the Oh Baby podcast. As promised, today we're talking about the difference between midwives and OBs or obstetrician. So what is the OB? What is an obstetrician? You'll hear me reference obstetrician as an OB because in healthcare, that is what they're referred to. If you hear me say OB, I am referencing the acronym or the short name for obstetrician. And so what is an obstetrician? So first off, an obstetrician or an OB, as I stated before, is a medical doctor. They specialize in pregnancy, in childbirth, and in the postpartum period. They're trained to handle things that are high risk. So high risk pregnancy is what they are really trained to do well. Their area of expertise, right? The reason why OBs are really special in what they do is because they are also surgeons. They can perform surgical procedures like C-section. That is essentially what an OB is. Now, as far as their education, according to the American College of Obstetricians and Gynecologists, the ACOG is what we refer to it as in healthcare. OBs complete extensive education and training, including medical school, residency, and oftentimes there's also this additional fellowship training that they do as well. The bottom line about what are OBs or what can they do is just to understand that they are well equipped to handle any complication that may arise during your pregnancy or during your birth. So if there's something you go in for an appointment and they are noticing a deceleration in the baby's heart rate, or your blood pressure is now an issue, they are equipped to handle those complications. Anything outside of the normal process of being pregnant and then the actual delivery of the baby. Okay, what exactly is a midwife? A midwife is a trained professional who supports women through pregnancy, labor, birth, and the postpartum period. So as you can see, they both are there to support pregnant women during the pregnancy, labor, birth, and postpartum period. However, the training is different. So we need to say that there's different types of midwives, right? There's the certified nurse midwife, and then there's the certified professional midwife. So certified nurse midwives start out as nurses. And so their background is nursing. They went to nursing school, they practiced as a nurse, and then they decided they wanted to extend their knowledge and training to support pregnancy and the labor and delivery from a provider standpoint. And so they go to a nurse midwife school, and usually it's an extensive process to the schools. I know here I'm located in Michigan. There is one at the University of Michigan, and it's a pretty extensive program. They are trained well. They're trained in the hospital setting. So sometimes there's like this notion that if you have a midwife, that means you have to give birth at home. And actually, and I'm just going to speak specifically to where I am. However, keep in mind, there are different midwives with different levels of training and different settings all across in the different landscape and settings of giving birth. And nurse midwives here at the University of Michigan, where they're trained, actually practice in the hospital as well. And again, their background is nursing. So they've gone to nursing school. They've already been a nurse. And now they have decided to extend their training to become a nurse midwife. Now, I mentioned that there were two different types of midwives. The other type is certified professional midwives, or what we call CPN. And they are trained, but it's through other accredited programs. So there are accredited programs where your background does not require you to be a nurse. Okay. And if you are considering going with a midwife, then the next decision you need to make is, am I looking for a certified nurse midwife or a certified professional midwife? Because their trainings will be different. One will have more of a nursing background and one will have more of a holistic birthing background. For a professional midwife, they are necessarily nurses. So you need to consider that if that information is important to you. According to the American College of Nurse Midwives, Midwives focus overall on a holistic approach to childbirth. They often emphasize natural births and personalized care. They are very skilled in normal pregnancy and births, and they do provide very comprehensive care, both prenatally all the way through to postpartum care. And so it's important to understand that when you hear about the OB and when you hear about the midwife, the experience is going to be different, and it's wrapped into this whole notion that it's based on their training being different, their focus of care being different. Okay. OBs are more clinical. They are specialists, and they are the top level. And by top level, they're able to address every complication that may arise concerning high risk birth. So they are skilled at the top level to handle. Midwives are also very skilled in what we call normal pregnancies that are not high risk, pregnancies that are very, I don't want to use the word stereotypical because every birth is different. Every birth has its own thing, but that follows the normal landscape of what the normal expected trajectory of how a pregnancy is to progress and how a delivery is supposed to take place. And that it's important to understand who they are and what they do, just so you can evaluate, where you are. What does that mean for you right now? That means that if you have already been determined to be someone that would be considered higher risk, it may be important to you to consider hiring an OB. Let me just put a pin here to say these are recommendations. This is general information, but I want you to take it and apply it to you and what works best for you. Everything here is you take it and you filter through the information based on your health history and what you know to be true about your body and your pregnancy. Why am I saying that? I'm saying that because if you pregnant with twin, multiple babies or a multiple birth, right? Pregnancy with more than one baby is considered to automatically place you in high risk category. And the assumption would be, I have to go with an OB. Now, training wise, it's a perfect match. It is a perfect match. As a doula, as a lactation consultant, have I encountered women who had a pregnancy birth with a midwife? Yes, I have. And so that's why I said you have to really take the information and filter it through your personal health history and your personal pregnancy to be able to make the best decision for you, because there's a lot of things that come into play. All right. So the next thing that I want to talk about, now that we've established like what an OB is, what a midwife is, let's get into what would be the benefits of having an OB and what would be the benefits of choosing a midwife. There are benefits to both. And I want to make sure that we talk about that so that you can really consider this as you are making your decision. So when you think about choosing an OB, one of the first things to consider is, again, has your pregnancy been labeled as a high risk pregnancy? And if so, to what extent? Is it high risk because once you hit a certain age, you're high risk? Is it just an age-based factor? If so, you may still consider, yeah, I am that age, but I'm still very healthy. I work out regularly. I have a great nutritional diet that I follow. And so I'm confident that I can choose a midwife. But if you know that you are high risk due to a medical condition, or there have been tests run and maybe a medical condition has been identified in utero with the baby, then having an OB could potentially be the best fit for you based on those indications. If you have a chronic health issue, again, if you have multiple babies like twins or triplets, or if you feel like you are predisposed to possibly be at risk for having preeclampsia, which is a condition essentially where as the pregnancy progresses, your body begins to tolerate your pregnancy less and less, and things start to go out of whack. and they can really derail very quickly. So like your blood pressure and a lot of other levels that they check as well. And so if you are at risk for that condition or other chronic health condition, then you need to consider yourself as high risk and possibly choosing an OB to be able to address some of those issues. The other benefit to choosing an OB is access to surgical intervention, like a C-section. I'm specifically speaking about a C-section. So let's say have labored and now it's time to deliver, and there's been something to happen in that time frame where they need to get the baby out quickly. Again, birth is a very natural process, but each one is very different. Every baby is different. And if something happens because often they are monitoring the baby while you're laboring in some shape or form to monitor the heart rate and things like that. And so if they can identify something's going on with this baby, we need to get the baby out immediately, then your OB is prepared and trained to be able to do that. So that is also a benefit. Hospital-based care is another benefit. And you might say, why would that matter? It matters because if any emergency arises, you already are there. You don't have to be transported. And sometimes, even outside of pregnancy, medical emergencies you're on a time limit. If it's a medical emergency, a lot of them need to be addressed within a certain amount of time to protect the life of you. And in this case, specifically speaking for pregnancy, you and your baby. And so being at a hospital where they have advanced equipment and can address a multitude of needs, that could be important for you. Also, too, I will say that being in a hospital is helpful if there are concerns outside of your pregnancy that actually play a part in weighing in your pregnancy. So let's say you have a chronic health condition that could potentially affect your pregnancy, your delivery, your postpartum. If you're in the hospital, there are other doctors of other specialties that your OB can lean on, can refer to, can reference to have some insight in terms of your total care during that time. And so that's something to consider. Okay, so those would all be reasons why choosing an OB may be beneficial to you. So now let's go ahead and jump into why someone would choose a midwife, because you hear that. And a lot of times they're like, okay, why would I even choose a midwife? There are benefits. So let's take a look at, why someone would choose a midwife. Number one is the personalized care. Midwives often spend so much more time with their patients during prenatal visits, and they just have a personalized care. They build a strong relationship. Now, I'm not saying that doctors or OBs can't do this, but oftentimes OBs that are part of that healthcare system, that hospital-based healthcare, also have other patients they're rounding on, and their patient load is usually much bigger. And so that personalized care at times can slip away from doctors who are really hard pressed to see a higher volume of patients. Whereas a midwife, they are really trained, regardless of if they're the nurse midwife or the professional midwife, they're both really trained to put emphasis on personalized care. So your doctor visits are much longer. You're not going to the doctor and waiting 15 minutes or waiting to see the doctor for the doctor to only come in 10 or 15 minutes. Like, they spend a lot of time with their patient. And based on who you are and the type of support you need, that may be very important, very important. A lot of midwives do visits even in home. Matters to some people that I can even have my provider come into home where I feel comfortable, and then have like their partner there to be there to support them through the visits. And so personalized care is important, especially to a lot of people who choose to have midwives versus an OB. Another benefit is the holistic approach. So midwives emphasize a natural birth with as less intervention as possible. And to me, I think if you are taking a holistic approach to your pregnancy, then having a midwife almost seems to be the perfect match, because their specialty is normal pregnancy with very little to no complications, they're able to allow that natural process of birth to really shine through. And so if that is your goal, if that is the type of birth experience you want, and you don't have any special or concerning situations that you're concerned about, then a holistic approach with a midwife is a very viable option. Another benefit to choosing a midwife is the birth setting. So midwives attend births in a lot of different settings, not just in hospitals. So they can, especially if it's a nurse midwife, they can choose to deliver at a hospital. They can also see patients at birthing centers and at home as well, based on their certification and based on your preference. I think it's important to note that statistically, midwife-led care is associated with lower rates of interventions like C-sections and episiotomies, epidurals, and all of those higher levels of care. And I think part of that is because they are so attuned, but part of it is because as a responsible midwife that is practicing sound medical care for their patient, I think it is the responsibility of the midwife to help the patient to either confirm or to refer. And what I mean by that is when midwives assess a case, they're being trained to support women at a very high level that have been noted to have a quote unquote normal pregnancy, no outstanding chronic health issues for themselves or the baby. That is where their strong suit is. And so if you're practicing responsibly as a midwife, I think it's important to then counsel appropriately, meaning that if you have a mom to come to you and you've identified that there is initially, you thought, okay, this would be great. She thought it was a good fit. You guys really seem to match in terms of personality, just getting along well and having that alignment, right? But if you at any point notice that, okay, we've now found out that the baby may have a particular issue or mom may have a particular issue that is outside the scope of my practice because this is no longer a quote unquote normal pregnancy. This requires more treatment. Then I think it is the responsibility of a midwife to then refer out and say, hey, I think we need to bring this OB in this case because this may require a bit more than what I am able to provide for you. And so I'm saying all of that to say, when we look at midwives' care being lower in C-sections and episiotomies and epidurals, a lot of that is because that's outside of their scope anyway. And so if you are a practicing midwife, then those are not procedures that most midwives are certified to be able to do. And so if they are operating ethically, they should be having an open and honest conversation with you if, as the pregnancy progresses and they realize that things have gotten a little further beyond their scope of practice. And so that is something to consider as well. So just to go over a few things. Number one, you want to think about your health and risk factors. Is there any reason why you or your baby would be classified as high risk due to age, due to health and chronic issues, due to being at risk for preeclampsia and things like that? Is there any reason, has the baby been tested in utero and you are anticipating that there could be an issue with the baby? If so, then these are all things you need to consider when you talk about choosing either a OB or a midwife. Also, birth preferences. Do you prefer to have a natural low intervention birth? Because if that is important to you and you are high risk, then it would be definitely worth your while to then interview quite a few midwives until you find one that really aligns with you and your birth. The setting, is it important for you to birth at home? Or are you looking to birth in a facility, but not necessarily at the level of a hospital? Would you like to birth in a birthing center? Or you could be at a point where you're like, listen, I just don't like to take chances. I want to be at a hospital And yeah. Or sometimes moms will say, hey, I just would like to be at a hospital because I live too far to be transferred if something happens. And so I just would prefer to go there initially and to be treated at a hospital in case the need should arise already there. So that's something to consider, the setting. Also, the philosophy of care. Are you looking for a more extensive medicalized approach where certain interventions are very common and used often? Or are you looking at more of a holistic, patient-centered type of situation where you're doing visits at home, the birth will take place at home, and you like to have more of a personal relationship with your provider? And last but not least, I didn't talk about this, but also the availability, depending on where you live. Like I said, you need to figure out, if I need help, can I get it? If I start out on this holistic approach and something happens, will I be able to get help in a reasonable amount? And so the availability of the healthcare systems in your area is also very important to consider. Now, two questions that I get often when I'm working with clients as their doula is, what if I start out with a midwife, but if I notice complications, can I switch to a OB if they arise? And the answer is absolutely. Absolutely. In fact, a lot of, and I say reputable because when you're a provider, you have to build that network of care because you understand that you can't do it all, that there are some things that you need to be able to utilize should an emergency arise. And so a lot of midwives work collaboratively with OB. And so making that switch is definitely an option. And if complications arise, you need to ask, when you are interviewing midwives, if this happens, will I be able to be referred to? And if they say yes, you might even want to ask, okay, so who would you refer me to? And that way you can even do just a quick look, a profile of that provider that they refer to. If you are not pleased with that, you can always refer to your own OB that may be somebody that you've already looked up. But the bottom line is you can absolutely switch from a midwife to an OB, or vice versa, from an OB to a midwife. So just keep that in mind. And then the second question I also get quite a bit is, what is the cost of each? And I think it's important to definitely check with your insurance based on where you live. If you're here in the United States and you have health insurance, you need to check and see what kind of coverage, what kind of care is covered. Do they cover midwives as a provider? And if so, does it have to be a certified nurse midwife, or can you work with a CPM, the professional midwife? So you need to ask all of that of your insurance company. Overall, generally speaking, midwife care is cheaper than OB care. And a lot of that is based on a couple things. Number one, OBs typically always work out of the hospital. And so you have a lot of costs associated with the setting, with where you're going to be giving birth. But also, too, because OBs are extensively trained, they are compensated respectively, meaning that it's going to cost you more per hour for their area of expertise than it would be for a nurse midwife or a midwife of any background training. And so the cost is more for OB versus the cost for a midwife. The setting is going to be different. And so the setting of a hospital is going to cost more than a birthing center, or obviously for you to birth at home. And then last but not least, one of the other factors that's associated with cost is also liability insurance. So anytime you are a medical provider, you have to carry a certain amount of insurance. No matter what kind of healthcare provider you are, when you are providing care, if you are practicing ethically and responsibly, you should be insured. And because OB have such an extensive training in terms of they are also surgeons, they are also considered to be surgeons because they practice surgery. they have the amount of liability that they carry is higher than someone who doesn't practice surgery. That's just across the board. And their insurance is higher. And so when you talk about the cost, those are driving factors for the cost of an OB versus the cost of a midwife. And I will say this just because I thought about this as I was recording this episode in terms of recently I was watching an episode on 60 Minutes and it talked about how there are birthing deserts. I'm in the United States. So in the southern part of the United States and some of the more rural areas, there are what they call birthing deserts, meaning that it's a twofold problem. They just don't have a lot of doctors, a lot of midwives in some of the areas where, it's less populated. And so the problem that causes is that those women have to drive miles and miles to get prenatal care and then ultimately to give birth because there's a lot of trained doctors in the area. And also because there's a lot of hospital systems in certain areas in these birthing deserts. And so what the outcome of this report that I was watching is just simply that they've had to innovate. I would say innovate is the word because they are now creating programs where people can train and be able to assist these women and babies, infants that live in these birthing deserts so that they will have some sense of support during their birth. And the way that they've innovated is to start training EMT workers on how to do delivery. They have, even in some cases, like they have the support of some doulas that are there to help assist. It is not the role of a doula to deliver a baby. Let me be very clear about that. We are there to support them while they are laboring, while they are giving birth, but we are there to deliver the baby. That would be the job of a midwife or an OB. However, they are utilizing doulas to help in some of the prenatal and the postpartum care because otherwise these moms just don't have the support in these babies. And so it was just a very interesting segment to watch because especially where I am in a city, you forget that there are women and infants that are really suffering. And in some cases, just there are not great outcomes concerning it. And the overall answer would be to choose one, to be able to have the option of just choosing one, a midwife or an OB, and they don't have that choice. And so I say to you today, take all of this, consider it. If you are blessed enough to be in an area where this is even an option, y'all, that's a blessing. Honestly, it really is to even be able to make the choice because some people, they don't have choice as an option. They just have to go with what is available to them. And so if you have this as a choice, really take this information. Hopefully it was helpful to the degree that you are now informed about what a obstetrician is, what a midwife is, what are the differences between the two, and what to consider when you are choosing which provider to work with. They are both capable of supporting women in the pregnancy, labor, delivery, and postpartum areas of care. However, depending on your specific medical need, you have to assess what is best for you. And hopefully this is helpful in doing that. I love talking to you guys. I love just being able to hang out with you here. If you enjoyed this episode, or if you know of another pregnant mama who could benefit from listening to this episode, please let them know. Please share. Don't be hesitant to leave a review and let me know if you found value in this episode. I can always be reached at birthprepacademy.com. That is my website. There's a bunch of good resources there for you to check out as well. Y'all, I love you. Until next time,